Hello everyone, welcome back to the Anatomy Lab. Today we're going to have a brief look at the ocular muscles, or the extraocular muscles, which are going to be on the outside of the eye, helping your eye to move in different directions so that you don't have to completely move your head in order for you to look at something else. So if you look closely, there's a lot of different red fibers on the outside of the eye. Generally, those are the muscles. So first of all, a couple of terms that's really helpful for these muscles are either the term rectus, which means straight, so straight back, or oblique, which means angled, which is not straight. So if it's at any other angle besides like just straight, like you would typically call this an oblique in this case. And you have a rectus muscle for each side. So if you look closely, you have a rectus muscle on the top, superior rectus. You have a rectus muscle on the bottom, inferior rectus. And then you have two muscles on the sides as well, which are medial and lateral rectus respectively. But there's an interesting question that you need to ask yourself. How do you know which side is which? So there's a good way to do that actually, which is using the oblique muscles. So look closely and you can see that there is a superior oblique, but then there's also an inferior oblique. And if you look at the attachment of the inferior oblique especially, this is a really good indicator. The inferior oblique is going to be attached to the eye on the lateral side of the eye. So if you see this attachment here, this muscle would be the lateral rectus. So lateral rectus, and then on the other side, no attachment of inferior oblique, medial rectus. So those would be the extraocular muscles, and in the eye socket you can even more see like the superior and inferior obliques, and if you have like the nasal bone and the rest of the eye socket, it makes it even simpler. But in a model like this, using attachments and using reference points is going to be critical for figuring out what's what. But that's about it for today. So once again, thank you for listening. Good luck with your studying, and I'll see you all next time.